You're listening to Transcaster Radio, a podcast about trans life and all that goes along with it. You can listen to the show anywhere you enjoy podcasts, and we'd love for you to subscribe, rate, and give a review. It helps us reach more people, and we greatly appreciate it. Now, here's your host, Caden Taylor.
Hey Transcasters, welcome to this week's episode of Transcaster Radio. I'm your host, Caden Taylor. This week we're going to talk about top surgery and all that goes along with it. On June 14th, 2018, I had top surgery with Dr. Sassani in Plantation, Florida. Prior to my top surgery, I spent months and months researching surgeons results, the cost of the surgery, if my insurance would cover it, what I wanted my results to look like. I basically asked tons of questions to people who had top surgery. Of course, I talked to different surgeons and asked a bunch of questions. Anything and everything I could get my hands on about top surgery, I did. I honestly wanted to be as prepared as I could be prior to top surgery. Some people don't necessarily think it's a huge surgery compared to bottom surgery, whether or not it's trans woman or trans man bottom surgery. But I disagree completely. It's a very invasive surgery and should not be taken lightly at all. All honesty, I think in any surgery should not be taken lightly. Anytime they're putting you under and cutting you open in any way whatsoever, whether or not it's minor laparoscopic surgery to open heart surgery, it's serious because something could go wrong and you don't know if that time could be the time you go under surgery. But I don't take any surgery lightly. I make sure that I'm prepared and as healthy as possible, and I trust the surgeon and that I'm as prepared as possible. I mean, the risk can be high, medium, or low depending on your overall health as an individual. It's different and each situation is different. Obviously, somebody that has worse health problems may have a harder time during surgery. So those are things that you want to make sure you talk about with your surgeon and clarify anything, including, if you're taking medications, if you need to stop them, or when should you take the last one. Like my testosterone, I had to stop taking for 2 weeks prior and 2 weeks after. But like my psych meds, I wasn't on blood pressure pills at that. No, was I? Yeah, I was on blood pressure pills at that time. So my psych meds and my blood pressure pills, I actually took my psych meds up to the morning of, and my blood pressure pills I took up to the night before. So it really depends on the meds and also the surgeon, because each surgeon has, different parameters on what they are okay with you taking. I actually had my top surgery almost to the same day of being on testosterone for a year. They're actually 2 dates apart. My T anniversary date is June 16th and my top surgery was June 14th. So almost to the day I had my top surgery from my T date. Deciding to have top surgery was a huge decision for me. It was truly a life-saving decision. There was no debate for me. I had to have top surgery. There was no choice. The dysphoria I had with my chest was completely unbearable, and I could no longer take the anguish I was going through on a daily basis. And we all know that wearing a binder is extremely, extremely uncomfortable. And I live in Florida where it's 100 degrees all the time. So right shortly before I had my top surgery, I went to a preseason game, a spring season game for baseball, and I literally couldn't sit in our seats because it was in the middle of the sun. So I didn't really get to watch the game. I would walk back and forth, but I had to stay in the tunnel where it was shaded, so I didn't feel like I was literally cooking from the inside out. So there was a lot of reasons why I needed for it to happen, but those are some, and honestly, it differs for everybody. Some people don't have as bad dysphoria for trans men for the top, and some don't. I mean, that goes for trans men, trans women, non-binary people. It just depends on what your dysphoria is. As we progress through this episode, I'll talk to you more about my experiences with my top surgery, but let's get into the meat and potatoes of top surgery. I didn't know this until I started researching, but there are actually 8 different types of incisions for top surgery. Some are obviously more common than others, and I'm going to list off the types of incisions that there are. There's liposuction incision, keyhole incision, periareolar incision, double incision, inverted T anchor incision, fish mouth incision, lollipop incision, and 2-stage periareolar incision. The reason why I call it an incision type of surgery is because for it all, it's called top surgery. And it's just literally the type of incision you get. So regardless of, it's either a double mastectomy or a top surgery, and then it's a form of incision. So I'm going to call it an incision throughout this episode. So just know that I'm relating it to the type of incision you get for top surgery. The most common top surgery incisions from my research was the double incision, the keyhole, and periareolar. So let's talk about the different types of surgery you can get. I'll start with the most common and then we'll break it down from there. The type of incision I chose, and frankly it was probably the only choice I had, and it was the one that I had really decided that I wanted due to the kind of results was double incision. I had a big chest, and frankly, there was no way I was going to get away with keyhole or periareolar incision. I might have gotten away with maybe the inverted T anchor, but I don't think I would have been as flat as I am with the double incision. The double incision approach is, they also call a bilateral mastectomy, which is typically given to women, cis, or you as a trans woman, you can get breast cancer too. It's typically given to those to remove, and they remove all the tissue with the bilateral mastectomy, where top surgery, it's constructed to have a male appearance, and that's where top surgery and a mastectomy are different, because they still leave some chest tissue when they do any form of incision for top surgery. So you always have to keep that in mind. The double incision approach is typically used for people with big chest, sagging chest or loose skin. If your nipple, the tissue is shaped to where your nipple position is lower than the fold beneath the tissue. One of the effects from taking testosterone, that since I wasn't on prolonged period of times, but it is sagging of the chest, and the longer you're on testosterone and you haven't gotten top surgery, the more prone you are to sagging of the chest. So this is another reason why people get the double incision approach. The surgeon typically makes a horizontal or U-shaped incision on the lower border of the pectoral muscle, which is your chest muscle. When I was making a decision of how I wanted my incision to look, because my surgeon in particular that I chose, Dr. Sassani, he's very particular on you telling him what you want your aesthetic appearance to be, which is what it looks like to you, what your scars are going to look like, because in all honesty, most of us, have some form of a scar there the rest of our life, unless you have like some famous skin that I need to know about. I didn't want it straight across. I didn't want it squared. I asked my surgeon, and I asked for a U-shaped incision. Basically, I wanted it to go with the curvature of a typical natal male's chest looks like. And that's obviously with the indication when I got top surgery that my fat ass would get up off the couch and go to the gym on the regular basis and get rid of my, get some chest muscles and then hoping that with in a large chest and chest muscles that it would hide some of my scars and my scars wouldn't be as prominent. But as I said, my fat ass, I have not gone to the gym consistently. So I've got the results of the kind of scar shaping I wanted, but I don't have the muscle to go with it yet. So maybe if one day I get motivated to go to the gym on a regular basis, then my scars won't be as prominent. Once the surgeon makes the incision, the skin is peeled back. So I'm going to put trigger warning out there because I won't say it very often, but I'm going to say a word that might trigger some of you, and that's the breast and fatty tissue can be removed. I apologize if I bothered you with that word. I will try not to say the actual female reference to your chest. I just wanted to say it in particular so you knew exactly what I was talking about. Of course, if I say it again, I'll make sure to do a trigger warning. Sometimes surgeons will do the nipple portion first. When I was doing my research, it was kind of 50-50. Some people did, some people didn't. My surgeon, Dr. Sassani in particular, does the nipple portion first in his surgery. The actual video that I found online, if you YouTube top surgery, they will show you, I forget which surgeon it is, but they talk about top surgery, and they do a video of a surgery being done. It's obviously not the whole entire time because it's a long surgery. It's cut into pieces, but it's a good video, and it gave me a good perspective prior to having my top surgery. I had never seen it done. I didn't know exactly. I mean, of course, you can look at pictures and stuff that they provide you, but it was if you're okay with gore and, blood and things like that, then I would highly recommend you watch it. But if you're not okay, definitely don't take the time to watch it because it might gross you out. When they do the nipples, each nipple is resized to replicate the natural size of a natal-born male, which is a cis male. Once the surgeon stitches the skin back together after they've done the whole procedure is when they actually replace and use a free nipple graft. They position it in a manner on the chest that is typical to a cis male, and this gives the chest a more masculine appearance. Some people choose not to have nipples. I have friends that have chosen not to have nipples, and I think that's a personal thing. I did choose to have nipples, and I think that's a personal decision. I don't think anybody can answer that decision for you. I think on a personal basis, you need to decide, do you want to look at your chest with nipples the rest of your life, or do you want to look at your chest without nipples the rest of your life? The surgery itself typically lasts 3 to 4 hours. I think mine was around 3.5 hours, and it's done under general anesthesia. Before the incisions are sealed up, the surgeon will place 2 drains consisting of long, thin tubing that have bulbs at the end of the tubing that stay on the outside of your body. Not all surgeons use this, but the purpose of the drains is to collect excessive blood or fluid, and they're typically left in place for about a week, maybe less, could be up to 10 days. It really depends on your surgeon. Mine were in for a week. They were taken out when I went back for my follow-up in a week when they took all my bandages off. The tubes actually kind of freaked me out in the beginning. I knew they were going to be there, but still knowing that these long tubes were inside my chest was just a tad strange. I personally did not drain the bulbs myself. My fiance measured the fluid in the bulbs each day because that was a requirement for my surgeon, and wrote it down and then drained them out every day. Sometimes in the first couple of days, I think it was multiple times a day. And it got to a point where there was little to no fluid build up in them. I was having excessive fluid on the right side, but I think it was my right side. Yeah, it was my right side. And it did eventually stop draining for the most part by the time I got my tubes taken out. like I said, most surgeons do use the tubing. Not all of them use the tubing. It really just depends. But it is more, from my research, that more majority of surgeons actually do use the tubing. Each surgeon, of course, has their own different post-op instructions. My surgery, I was unable to take a shower until I had went back to have the bandages and the wrap taken off, which was a week. So in the meantime, I did little sponge baths. I cleaned under my arms. I cleaned my nether regions. I cleaned everything that I thought was going to make me stinky. Then once I got my bandages taken off, I was able to see my chest, and I was finally allowed to take a shower. There is one limitation, at least from my surgeon, was that I was not able to face the shower head. And the reason for this is that the water pressure from your shower head, of course, not all showers have extreme amount of water pressure or none, was so that it doesn't take your nipples off. I know, that sounds kind of weird, but it's true. My fiance and I had a scare, a minor scare. It certainly wasn't a minor scare at the time, but she was my nurse during my recovery, and she was changing my bandages. This was after a week of having the bandages on, because obviously I couldn't see my chest for a week. And she was taking one of the bandages off, and she had this weird look on her face, like, oh my God, what did I do? And I looked at her and I said to her, what is going on? Like, what have you just done? And she literally starts peeling the other side of the bandage, and I'm thinking, is there something wrong? And of course I'm thinking the worst, my nipple's coming off. And so I said to her, I'm like, are you ripping my nipple off? And she wasn't, but we laughed for days afterwards, because what happened was my nipple was scabbing, and after they take the bandages off, you have sometimes a big scab there, and the scab was peeling off, and it made her think that my nipple was falling off. So be careful. Make sure you don't face the water pressure, because I certainly didn't want to lose my nipples, and I don't think that you want to lose yours. I actually went without facing the water for 6 weeks. Taking a shower was actually extremely difficult for me, because I had T-Rex arms. I didn't want my scars to stretch, even though I had a tad bit of stretching on my left side. I didn't want my scars to stretch. I didn't want bad, scars. So I literally, for about 6 weeks, I took a shower with my fiance, and she literally bathed me. I couldn't wash my hair because I didn't want to raise my arms. And if it wasn't for her, I'm not sure that I would have been able to go out in public, because I think I would have stunk like a pig pen. She was extremely helpful in my recovery, and I truly believe that my scars look as good as they do because she gave me the opportunity not to stretch them out. And she got things for me. She put things down for me. It was rather an easy recovery with her assistance. I also did sleep in a recliner for 2 months, which sucked, but one of the things that I had read prior to surgery was that you can stretch out your scars by sleeping in bed too soon, because you are moving around, your arms are moving, you're not, where you're awake, you can control where your arms are going, but when you're asleep, you can't. So the recliner actually confined me to an area, which I think in the long run helped with the way my results came out with the top surgery. So let's move on to the next type of incision. The keyhole incision is typically ideal for patients who have a small chest and people who have good skin elasticity. So this is somebody who maybe isn't on testosterone for very long periods. Maybe they're not on hormones at all, or they've been on it, but they have really good genes and have very elastic skin. This is performed by a little small incision, and it's made under or across the lower border of the areola. For those of you that don't know, the areola is the pigmented skin around the nipple for everybody. Just natal male, cis male, born males, theirs are typically smaller, and that's why ours for trans men are resized when they are put back on to your chest. So the keyhole incision can remove underlying skin, but cannot take care of excess skin. So if you, like I had extreme side chest, and that was a big reason why I needed double incision. So people like me who have a big chest or saggy chest, this incision would not be suitable. If I would have had this type of incision, I would have definitely ended up with excessive amounts of skin left on my chest. I definitely would not have gotten the result I wanted. And even for people who have a small chest and elastic like skin, this procedure does not always give the result the patient is looking for. So don't think that, oh, I'm perfect for this, and then you get the surgery and it's not the results. It's not always perfect. It's not, it doesn't always come out the way you want it to. So make sure that when you're deciding on the type of incision you want for your surgery, that you talk to your surgeon, you go over the types of incisions that are available, that surgeon does. What does the surgeon think you will do best with? What kind of results you want? Make sure you ask those questions, because I'm telling you, it's really important for when the surgery is done and over, and so that you don't have to have revision surgeries, because that's the last thing you want to have to do. So the next incision is the periareolar incision, and it's a lot like the keyhole incision. This incision is typically used for patients with small to moderate chest tissue, also people with good skin elasticity. Typically, a circular incision is made around the edge of the areola in order to remove the chest tissue, and then a slightly larger ring incision is made to remove the excess skin. This is what makes keyhole and periolar incisions different, is that second incision that takes off excess skin. This incision gives the surgeon the ability to remove some excess skin, but not necessarily all of it. Like my surgeon and I went over this incision. I actually talked to my surgeon about every type of incision, and even though I was about 95% sure before I had my consultation of what kind of incision I wanted, I still went over these types of things. And because of the amount of side chest I had, I was not a good candidate for this surgery. Once the surgeon removes the tissue and the skin is pulled tight towards the center, the nipples are then reattached. So think about when you pull a drawstring bag, like the garbage bag, and you pull it together. It's essentially the same process with this incision. If necessary, the surgeon can make an additional vertical incision below the areola to get excess skin. This incision does require more incisions and scarring than keyhole, but is a lot less than double incision. So you might have an extra vertical incision down from your actual nipple, but it's definitely not as much of a scar from what you would get with double incision. Another type of incision for top surgery is the inverted T, which is one of the incisions that my surgeon and I definitely talked about in depth, because it was another possible option for me. An inverted T incision is another option for people with big chests, but I actually had a hard time finding surgeons that would actually do it. There aren't very many surgeons, at least from my research, that do it. If you guys know of surgeons who do the inverted T incision, let me know and I'll get that information out to everybody. If you have had this incision for your top surgery, I would love to hear about it and how your results turned out, because I haven't met many people that have had this type of surgery, and the few people I have met, they're not 100% satisfied with their results. One person in particular is actually going to have a revision. So if you have, whether or not it's been good or bad, let me know, because I'm just curious about how your results were. This procedure, unlike the double incision, keeps the nipple and areola attached to the body, which avoids the actual need for a free nipple graft. So it is supposed to provide you more sensation in your nipples versus having a free nipple graft like with double incision. But even though the surgeon has a lot of control over how much chest tissue is being removed, so obviously the more chest tissue that's being removed from that location of your nipples, the less likely you're going to have sensation in them. I will tell you, I don't have erotic sensation in my nipples, but I never had an erotic sensation in my nipples before, but I do have nipple sensation. It is definitely different. It is weird, a feeling. I have never really truly been able to put the feeling in words, but it is different than when I felt my nipple or touched my nipple prior to top surgery. The inverted teat incision allows for a lower risk of the complete nipple sensation. And there are a few disadvantages. The patient does end up with a present vertical incision, and it doesn't always achieve the same level of flatness as a double incision approach would. Another incision is the fish mouth incision, which I did not find anyone who had done it. I had actually never even heard of it until I started doing my research, but I have not found a surgeon that does the fish mouth incision. This was never even something my surgeon and I discussed in our initial conversations. I didn't ask about it until after I had done some more research and found out about the incision. This incision produces cuts that are higher on the chest, which made it more consistent with the border of the chest muscle. However, this is one incision that requires the scar to be aligned with the final areolar position. So basically the scar is right in the middle of your nipple, which is obviously not a natural position of any kind of scar, but on someone's chest to have a scar right in the middle of the nipple. This personally, and for me, would not be suitable. I wouldn't want something like that, but it's definitely a personal opinion. And if you can get the results you want from it, then certainly go for it. Like I tell everybody I talk to about top surgery is whatever decision you make, it's got to be your decision, because you're going to be the one that's going to have the results and be happy with the results. So it's definitely got to be something you like. And remember, it's got to be aesthetically appealing to you. I mean, of course, you might consider what your partner thinks of your chest, or maybe a few other people, but ultimately you're the one looking at your chest every day or multiple times a day. So you have to be the one that is going to be happy with that. So think about that when you are thinking about what type of incision you want for your top surgery, because I'm telling you, it's important about what your own aesthetic appeal is. And same goes for if you have nipples or not. You've got to decide for what your own aesthetic appeal is. So something that I didn't know about, and I didn't even know that you could have it, is straight liposuction. It's considered an incision in top surgery. And it would literally be for somebody with a very, very, very small chest, no skin sagging at all, and then they might do this. Of course, they're still not going to get all the tissue out. With my double incision top surgery, I did have liposuction included in my surgery on each side, on the right side and the left side, and approximately the height of my armpit and a little bit over, they did liposuction. And a lot of it had to do with dog ears. So I had an excessive amount of side chest, like I mentioned before. So that needed to be taken care of so I didn't have dog ears. And dog ears happen, for those of you who haven't heard of it, are a result of not enough tissue being removed on the sides of your chest, and it can become flappy like a dog ear. This can be common for people with big chests, people who are overweight, like I'm overweight and I had big chest, so I had both facing me during surgery. And my scars actually go extremely far back on my back because of the amount of side chest I had, so that he could avoid having dog ears. I remember when I came home after I got revealed a week after my surgery. And of course, I looked at it, but I was so excited just to see my flat chest that I didn't completely look at the scars. And I remember getting home that day and thinking, oh my God, I want to take a shower. So I got undressed and I started actually looking at the scars and realized that they go far back. And honestly, that's fine with me because I like the fact that I don't have dog ears and I didn't have to go in for a revision. But some people might not like incisions to go back that far. The liposuction incision requires only about a 4 millimeter incision just to assess underlying tissue. Like I said, although this is an option out there, it's not typically used. And if it is, it's for extremely, extremely small chested people. Another incision that I never had heard of until I started researching was the lollipop incision. Who came up with this name? I have no idea. But this incision is actually one of the newer approaches. I did not see who started doing this incision, but this incision allows for a moderate amount of skin to be removed through a combination of different incisions. One incision is a circular incision around the areolar, and a vertical incision running downward from the areolar. So it's similar to like the inverted T, also very similar to the periareolar incision, but it's typically not done by many surgeons out there. And when I was doing research, I couldn't find a lot of information about the lollipop incision. I just found that it was a type of incision, but not a lot out there. So maybe since it's newer, more surgeons will start using it. I mean, to me, it sounds extremely eerie, similar to the other two, that I don't think it makes much of a difference, but it very well could. And if anybody out there has had the lollipop incision, please let me know. I'd like to know how that surgery went, how your chest healed. So if you've definitely had that, let me know. I'd like to know. The last incision is a 2-stage periolar incision. This one, the first step is the keyhole incision. So they do the keyhole, they make sure the tissue and skin respond appropriately, which is key to this incision. So they go into making sure that the skin and the tissue respond appropriately, and then they proceed to stage 2, which is using the periolar incision to finalize the surgery. So this is so that patients that don't need to remove more tissue can do this and maybe not have to have the second stage of surgery if the keyhole incision works the first time. And then they don't have to actually have the periareolar incision. So it just depends on what the results are after the surgeon does the first incision, which is the keyhole incision. Like I talked about before, I just want to reiterate is each person has to make the decision along with their surgeon on what incision is going to work best for them and what aesthetic look you're looking for. I personally didn't think of anything else other than double incision for the most part due to the type of results I wanted. My chest was definitely too big to get the results I wanted from any other type of surgery. And maybe it has a lot to do too with that was the surgery I saw the most results with when I started looking up top surgery. So it is definitely the most common, and you definitely get the flattest with that surgery. So it was the approach I wanted because there was no way I wanted to have surgery and still have any form of lumps on my chest to prove that I had once had those there before. Regardless of what incision approach you take with your top surgery, there will definitely still be leftover chest tissue, which means that you still need to be screened for chest cancer. And I know that nobody wants to, trigger warning, talk about breast cancer, but men can get it just as much as women or non-binary people. It can happen. So although you cannot get a typical mammogram after you've had top surgery, you can get what they call a sonogram. So you can ask for a sonogram. Typically, they start doing mammograms, so you would have your sonogram done around the age 40 to 45. So unless you have had chest cancer in your family history. So please make sure that even if you have top surgery, you still get checked for chest cancer because it can happen. Make sure to follow through on all your health care. It is critical that you stay continued to screen for the necessary things. I know that some of this stuff can cause extreme dysphoria. Going to a female-oriented place can be dysphoric. I've been going through some things that I've had to go to a doctor who takes care of female things. And I've had to sit in that waiting room with my beard, with all these women, and feel like something is wrong with me. So I know how dysphoric it can be, but you've got to stay up with your health care. Find somebody, a practitioner or a clinic, maybe an LGBT clinic somewhere close to you that takes care of transplants. I'm telling you, it's critically important to keep up with your health care. Recovery is an important aspect of your surgery too, and you have definitely got to be prepared for what could go wrong, but also for what couldn't go right. Don't just think about everything that could go wrong. Be optimistic about all the things that are going right. Prior to my surgery, I made sure I bought all the essential items that, of course, the doctor tells you to buy, but there was a few things that I didn't think about that I wish I've had. One thing in particular was a claw reacher, which is the thing that you old people use to grab things up off the floor. I couldn't think of what to call it, so I called it a claw reacher. In the beginning of recovery, it was extremely hard for me to move, to reach things. Although for the first week I had my fiance, after that I was on my own, so I had to rely on trying to get stuff up off the floor. She of course put things down like cups and stuff like that for me to use, but I'm telling you, it would have come in handy if I had had one. So think about maybe getting that. I had ibuprofen, but I didn't have a lot of ibuprofen, and I should have made sure I had an extra bottle because you're very uncomfortable during your recovery for the first couple of weeks. Some people are uncomfortable for longer than that, but I was definitely uncomfortable for the first week being wrapped so tight in that binder. And it definitely, I lived on ibuprofen for the first week just because of how uncomfortable I was. I am extremely, extremely thankful to my fiance for helping me, like I mentioned before. I know there's no way I could have gotten through my recovery without her. Like I said, I would have stunk like a stinky barn. One thing that I did get that I had heard a lot about was straws. I'm telling you, those saved my life. For the first week after surgery, I literally had straws by my side and used them all the time. Most surgeons will also tell you that at least the first 24 hours not to be alone. So make sure that, for the first 24 hours you're not alone. Like I said, I had my fiance for longer, and, for the 24 hours, I had her 24 hours for 7 days. But after she went back to school and work, I had to be by myself. So it was a little difficult after she went back. It was really difficult for me to rely so heavily on someone else for so long because I'm such an independent person. But even if you are like me and you're an independent person, trust me, take the time. If somebody is willing to help you, if somebody will grab that cup on, that shelf or in that cabinet for you, let them do it, because I'm telling you, the results will be worth it. Of course, I wish I didn't have any scars, but we all know that can't happen. But I'm also, in a lot of sense, I'm thankful for my scars because they released me from the things that caused me so much severe dysphoria for so long. Make sure when you decide to have top surgery, you do your research. Make sure to ask your questions like I talked about. Lots of them. There's never a stupid question. Make sure you ask the question. Make sure that the decision that is going to be the best for you. Don't let your surgeon talk you into something that you're not comfortable with. I'm telling you, make sure you ask questions and you're comfortable with the final decision you make, because although you can have revision surgery, you can't go back to a blank slate. Some places that you can check out that I used a lot was transbucket.com. Has tons of different pictures of all types of trans surgeries, so definitely go check that out. I did Yahoo groups, Facebook groups. I'm still on a ton of Facebook groups, so definitely go out there and check it out. Reddit top surgery groups. There's another website called the transitionalmale.com. I got information off there. I'm not sure if that website is actually still up, but go check it out and see if it is. And then you can check out the Trans Care Project of Vancouver, British Columbia. Those are just a few. There's, of course, now there are more out there. Best resource for me was transbucket.com, because I was able to look at other people's results. Of course, some surgeons will have before and after pictures of their patients, not of their faces, but of the area that the surgery was done, that you can check out. I know Dr. Sassani, my surgeon, does have that information on his site, and he updates it regularly with different people. So you can always go try your surgeon's website that you choose as well. If you would like any more information about the different types of incisions you can get with top surgery, let me know. I'll do my best to answer any questions, or I will definitely try to steer you in the right direction to get the information. All right, Transcasters, that's all I've got for you today. If you enjoy listening to this podcast, check out our Patreon page that we started. You can check it out either at our website at transcasterradio.com, or you can go to patreon.com/transcasterradio. There are a bunch of different tiers you can sign up for, and a bunch of fun different perks and rewards, even a private Q&A with me. So if you're interested, you love the podcast, and you want to keep supporting us, please go check out our Patreon. And until next time, love life, live authentically, and as always, rise up.
Thank you for listening to Transcaster Radio. Be sure to visit transcasterradio.com to access the show notes and discover awesome bonus content.